Welcome to the presentation for Module 5 in Nursing 150 regarding the assessment of the gastrointestinal system. Module 5 main concepts regarding the gastrointestinal system consist of concepts such as nutrition and elimination. Homeostasis of the body regarding these concepts is a balance between the two. A balance between proper nutrition and the ability to eliminate things that the body does not need through bowel elimination. Nutrition is complex and it involves ingesting all of the macronutrients and micronutrients needed for optimal cellular metabolism. Humans need to be able to take in proteins, carbohydrates, fats, and vitamins and minerals in a balanced way. Once it is inside the body needs to be able to properly digest and break down the food and absorb into the blood the basic elements needed for life. Through metabolisms, the cells are able to convert these pieces of nutrition into chemical energy and provide the body with the proper nutrients needed for to maintain homeostasis, for energy, for the cells and for the body. Proper nutrition is required in meeting the needs of the human person as far as nutrition. And for this presentation, we will review this assessment required to determine a patient who possibly has a disorder of in homeostasis related to either a nutrition problem or an elimination problem. This is a picture of the GI system. Main organs of the GI system are the mouth, the esophagus, the stomach, and the small and large intestine and the rectum. There are accessory organs that participate in the role of digestion and absorption. That would be your liver, gallbladder, the pancreas. The salivary glands also play a part in as an accessory organ of digestion and absorption. Problems that may arise in the GI tract are structural, mechanical problems, impaired mobility, infection, or cancer. And those are the disorders that we're going to talk about in Module 5. As far as structure, the GI tract consists of 4 layers. It's specifically made so that the intake that the patient takes goes through and flows through and is absorbed adequately. Anytime there's a problem with the structure, there will be a problem with nutrition and elimination. Functions of the GI tract include secretion, digestion, absorption, motility, and elimination. So typically problems that occur with the function is regarding digestion and absorption of the nutrients. The oral cavity consists of the buccal mucosa, which is the mouth, the lips, tongue, hard palate, soft palate, teeth, and salivary glands. All of the structures have to be formed at birth and hopefully throughout life in order for the patient to be able to maintain an adequate intake. The function of the oral cavity, is to begin breakdown of the food by what we call mastication, otherwise known as chewing. Taste is another piece of that. We have to make sure that we have proper functioning of taste, which aids in the intake of food. Teeth is an important piece of that oral cavity. The function and the structure of the teeth must be working adequately to maintain the first process of the digestion, which is the breakdown of food. The esophagus is the tube that connects the oral cavity to the stomach. It's a muscular canal. Its primary function is to move the food and fluids from the pharynx to the stomach. There are sphincters in place in order to prevent air into the esophagus. It closes that off so that the food goes into the esophagus, not into the bronchioles. And then the lower esophageal sphincter is there so that it closes and it decreases the reflux of the gastric content into the esophagus. the lower esophageal sphincter is not working properly, that results in what we will talk about as gastroesophageal reflux disease. The stomach is the part that begins the further breakdown of food. It's midline in the sort of to the left upper quadrant of the abdomen. There are 4 regions: the cardia, the fundus, the body, and the antrum. The function of the stomach acts as a food reservoir where digestive process begins. There's mechanical movements and chemical secretions that begin to mix with the food and starts to break down the food, breaking down large particles, and that empty eventually into the duodenum. The intrinsic factor is produced by the stomach, and that is required. The intrinsic factor is required for the absorption of vitamin B12 from the foods that we take in. Absence of the intrinsic factor causes pernicious anemia, which is a type of B12 anemia. The pancreas is a fish-shaped gland that lies behind the stomach. The function of the pancreas is to secrete enzymes needed for digestion of carbohydrates, fats, and proteins. Those are otherwise known as trypsin, amylase, lipase, and chymotrypsin. It also has what we know as the islet of Langerhans, with alpha cells that produce glucagon and beta cells producing insulin. These hormones produced are essential in the regulation of metabolism. This is just a visual picture of the liver, the pancreas, and again, these are accessory organs of the digestive system, the GI system, and it just kind of shows you where they sit in relation to, if you look at here, here's the duodenum this is where the beginning piece of the small intestine, where real absorption begins. The small intestine is the longest part of the GI tract, measures 16 to 17 feet in length in an adult. It has 3 parts: the duodenum, which you see here, which is the first part of it, the jejunum, and then the ileum. The 3 main functions of the small intestine are to movement of the intake, digestion, and absorption. The large intestine is after the small intestine, and it's about 5 to 6 feet in length from the ileocecal valve to the anus. Its function is again movement, absorption, and then elimination. Assessment of a person to determine any events related to a current gastrointestinal problem. Focus questions are typically related to their appetite, weight changes, and their elimination patterns. Begin to ask questions regarding history about their typical daily food intake. Has that changed? Has your appetite changed recently? Have you gained or lost weight recently? Was it intentional or not intentional? Are they on any special diets? Are they having trouble chewing? Do you wear dentures? Do you ever experience indigestion or heartburn? Lots of different questions that focus on that gastrointestinal area in order to determine what could possibly be their current health problem. There's a list of the best practice for safety and quality care questions for GI health history in chapter 52. Be sure to review those questions and begin to just think about what kind of questions would help you determine what kind of problems is going on in a patient's GI tract. We need to know what their age and gender and culture is. A lot of times that can help us. Nutritional history is very important. What kind of, are they eating a lot of spicy foods? Are they eating a lot of high fiber foods? Are they eating at all? Things like that. Family history and genetic risk. Of course, if they have a family history of colon cancer, there seems to be a genetic predisposition for colon cancer, so we might be a little bit more worried about that. Current health problems is going to help us understand what other comorbidities they have, whether they're diabetic, whether they've had a history of a gastrointestinal problem. Physical assessment of the patient for a GI problem is going to be looking at the whole GI tract, beginning up at the mouth. Do they have teeth? Do they have teeth that fit? Do they have functioning teeth? We're looking at the function and the structure of the GI tract, and think about how you would assess that. What's their mouth look like? What's the abdomen look like? Is it distended? Is it flat? Are they obese? Do they have bowel sounds? Do they have a tender area, palpation? Remember, you're always going to assess them in 4 quadrants: the right lower, the right upper, the left upper, and the left lower quadrant. Make sure you review in your book. It has a good table that tells you about the location of body structure in each abdominal quadrant. For instance, the right lower quadrant is where your appendix are. If you have pain and tenderness in your right lower quadrant, it could be indicating there's an appendix problem. Left lower quadrant contains your sigmoid colon, which is the lower part of your descending colon, and your lower part where elimination occurs. And midline, of course, is your abdominal aorta, and that's where you assess that. So just kind of review all that as far as a physical assessment. Psychosocial assessment is just going to be kind of finding out exactly what else is going on in the patient's life. Are they having high stressful situations? Because that can always affect a patient's ability to function adequately. Emotional stress can have an exacerbation, cause an exacerbation of irritable bowel and other GI problems, other GI upset. Just think about how sometimes stress can upset your stomach. So it's important to ask those questions as well. Diagnostic testing we're going to talk a little bit more about, so specifically in the next few slides. So just a picture of those 4 quadrants that you should always assess when you're assessing somebody's GI tract. You're going to listen to each quadrant, make sure they have bowel sounds, and then, palpate and make sure that they don't have any tenderness, pain, lumps, masses, or anything like that in those areas. Lab studies, taking blood samples to determine a patient's GI is going to be pretty standard. CBC always tells us if somebody is anemic or they have an infection, and that can help us to assess for maybe appendicitis or perhaps an anemia related to GI bleeding, or if they have a diverticulitis that's causing an inflammatory issue, that would certainly cause the white cells to go up. We'll sometimes check the liver panel just to determine if there's because we know that it's an accessory organ of the GI tract, so if there's anything going on with the liver. And the liver can also affect clotting times, because a lot of the clotting factors are produced by the liver. So we might check clotting times in the labs, which would include like a PT-INR. We'll check their electrolytes. That's usually on a basic metabolic profile, just to kind of determine how they're absorbing their nutrients. A basic metabolic profile that has electrolytes, and it would show us how their kidneys work as well. It would show us how their calcium, potassium, mag, and all those levels are going, how they're absorbing things. There's a couple of genes that we've identified, or a couple of primary antigens. It's CA19-9 and CEA that can help us in the diagnosis of cancer of the GI tract. These antigens may also be increased in benign GI conditions, but they are maybe some genetic testing that might accompany an assessment of a patient for a gastrointestinal disorder. Stool test can be a very quick and easy test used as a screening or as a diagnostic tool. It's recommended that older patients that may be at risk for colon cancer have a yearly guaiac fecal occult blood test. It's just a little card that they can take home and have a stool sample, and they can test it for any signs or symptoms of blood in their stool. The other stool samples that we might utilize in order to assess a patient with a GI problem would be checking a stool for like ova and parasites. C. diff, we can check stool samples for that, and that's typically the ova and parasites is for somebody who might have like a gastroenteritis, and then C. diff is for those people who are having a maybe more of a chronic diarrhea problem, and they have a history of prolonged antibiotic therapy. So just make sure you have an understanding of how to collect those stool samples for those patients that we might need. Imaging, typically start out with just your usual x-ray, which is a plain film of the abdomen. Possibly it's real non-invasive and real easy to do. It can show us some masses, tumors, structural problems, perhaps. It can show us like if there's pattern of bowel or gas problems. Upper GI series is an x-ray visualization from the mouth to the duodenal junction. So again, that's where the duodenum, the first part of the small intestine, so we can see the upper part. So that's the mouth, esophagus, stomach to the duodenum. And usually it's done for structural or functional issues of the esophagus. Upper GI is also known as a barium swallow, and basically what that does is examination of the upper gastrointestinal tract under fluoro after the patient drinks the barium sulfate. Prep for that is they're usually NPO after midnight. Sometimes they'll give them a laxative the night before. Basically, we want to kind of clear out the GI tract so that we can see what's going on in there. Post-procedure, they might again prescribe a laxative and instruct the patient to increase oral intake so that they can pass the barium. And they need to monitor and make sure that they do pass the barium, and that is confirmed by a chalky white stool that should occur. So then that'll help them understand that the stool is passed. Another diagnostic tool used for the upper GI is also known as the esophagogastroduodenoscopy, also known as an EGD. Basically, they sedate a patient and pass the scope down through the esophagus to view the gastric wall, the sphincters, and the duodenum. Can take tissue samples for that. The patient is required to be NPO for 6 to 12 hours before the test. That way, again, that the GI tract is clear so we can see. They will apply a local anesthetic, which will numb the throat so that the patient does not gag when they insert the scope. They might give them some medicine to decrease their secretions as well, and to relax their smooth muscles so that they can get the scope down. The nurse is there to facilitate kind of the patient positioning and make sure they're adequately sedated, and to monitor their vital signs and their oxygen saturation. Post-procedure, the client has to be NPO until gag reflex returns, which is usually in a couple of hours. Monitor for any signs of any perforation, which could happen as we advance a scope down the patient's esophagus. So that would be bleeding, elevated temperature. They are usually on bed rest until they're more alert and recovered. Use lozenges or saline gargles for a little bit of a minor sore throat that they typically get after this. The percutaneous transhepatic cholangiography is more a test to look at the liver to be sure that its function and structure is working, because again, it is an accessory organ of the GI tract, and if there's a problem there, that could be causing a patient's GI problems. Urea breath tests I don't have on this slide, but I'll add it here. I didn't put that E. Basically, that's an interesting little test that can detect the presence of Helicobacter pylori, otherwise known as H. pylori, and that's a bacteria that can get into the GI tract that causes peptic ulcer disease. The patient consumes a capsule of carbon-labeled urea and provides a breath sample 10 to 20 minutes later. and it just can determine it's either positive or negative if it's the H. pylori is present or not. And there's some meds they have to avoid prior to doing this test. They have to stay away from antibiotics, Pepto-Bismol, sucralfate, omeprazole, which is Pepcid, Prilosec, Tagamet, Zantac, the ranitidine, famotidine. They should avoid those meds prior to this test. It can skew it. Barium enema is also listed here, and it's essentially an enema that's given with barium that, again, then the patient is put under fluoro and taken pictures of, and that can show us structural or functional abnormalities of the lower GI tract. Again, it'll be increasing fluids and monitoring their bowel elimination to make sure that they get rid of the barium. They eliminate it. CT scan is just a diagnostic tool that we could use for typically more like diagnostic cancers, diagnosing cancers, and just getting a better structural view of something that we have identified maybe on an x-ray that's suspicious. Then we would go ahead and do a CT scan to follow up in order to do a more diagnostic test. Ultrasound sometimes is done, like an ultrasound of the gallbladder, to determine whether there's a abnormal function there. Colonoscopy is an endoscopy test. Again, it's a scope that has a camera on the end of it that can be inserted in the colon to the lower GI tract to assess and diagnose any problems of the lower GI tract. American Cancer Society says that beginning at the age of 50, all healthy men and women should have a colonoscopy every 10 years or some other screening, but they highly recommend a colonoscopy. They will have to have it more frequently than every 10 years if there is a problem found. So typically if polyps are found on that initial one at the age of 50, they might have to come back the next year and monitor those polyps. Patient prep for colonoscopy is pretty extensive. Essentially the day before their NPO, not NPO, but they're only taking clear liquids and they're drinking a bowel prep that will completely clean out their lower bowel. Typically Go Lightly is a brand name that they'll have to use. It's a bowel cleanse that they drink pretty much all the day before. And they usually have to avoid red, orange, or purple beverages in order to so that it doesn't appear that they have anything red in their bowel, so it doesn't skew anything that they see in there. Patient undergoing a colonoscopy is again sedated. There's a good chart in your book that talks about care of the patient after a colonoscopy. It's essentially monitoring vital signs, keeping them NPO until sedation wears off. You keep them in the left lateral recumbent position to promote the passing of gas, because sometimes they actually insert a little bit of air into the colon in order to clear the way so that they can see the mucosa very closely. The Schilling test is a test to determine whether someone has a pernicious anemia. The Schilling test measures urinary excretion of vitamin B12. And that's basically determining whether they have an absorption problem, whether they're not absorbing their B12. It's just a picture of a patient undergoing an esophagogastroduodenoscopy, otherwise known as an EGD. These looks like the physician is here doing this scope, and then these are the nurses that are administering the medication on their IV line in order to sedate them, and she's documenting everything over here. These are questions just to assess your learning. The answers to the question can be found in the comment section. I highly encourage you to do these to determine and assess your learning. And this concludes the presentation for Module 5 for the assessment of the GI tract.